Good morning. Thank you for joining me today. First of all, I want to offer my thanks and congratulations to the Savannah Police Department's Major Crime Unit, as detectives arrested 3 suspects in a triple homicide cold case that occurred in April of 2015 in the 1200 block of Northeast 36th Street. On August the 10th, the Chatham County Grand Jury indicted 3 suspects on charges of felony murder and malice murder. On August the 13th, the U.S. Marshals Southeast Regional Fugitive Task Force and SPD SWAT arrested 3 individuals between the 13th and August the 20th. The message here is that good police work remains good police work. Cold cases are never truly cold, and accountability will come, be it one day, or be it a year later, or in this case, 6 years later. I appreciate the fine work that our officers did in being able to warm this case up and now to clear this case. Our 10 Ways in 100 Days Summer Youth Violence Reduction campaign concluded last week, and I just want to take a moment to thank everyone who assisted. I particularly would like to thank Alderwoman Linda Wilder Bryan and the Moms of Murdered Sons, LB4 and After Foundation, Dominique's World, Moms Demand Action, Parents Against Killing, Enough Said, and the Savannah Girlfriends for stepping up to the plate. A lot of amazing, amazing women. I also thank the mission-minded men and the many nonprofit male leadership organizations that comprise this League of Extraordinary Gentlemen. And I hope that we will continue to meet, to organize, to collaborate, and to strategize. And I especially thank WTOC, WSAV, and Cumulus Broadcasting for stepping up and taking this 11 o'clock, do you know where your children are, and taking this campaign to a new level. Obviously, every night, it required parents to think, if just for a moment, to be able to think about where their children were. So thank you, WTOC, WSCV. I appreciate you all for partnering with us. And so it's my hope that although this was 100 days, this is really bigger than the 100 days, and that we continue these community collaborations and strategic partnerships to support parents and families and to strengthen our community. Over the next 2 days, the Savannah-Chatham community will pay our respects to State Representative Edward Mickey Stevens, who passed away last week. Public viewing will be held today from 12 noon to 4 p.m. at the Adams Funeral Services Chapel, located at 510 Stevenson Avenue. A formal program will be held this evening at 6 p.m. at Savannah State University's Tiger Arena. The doors will open at 5 p.m. with proper COVID screening protocols and a mask mandate enforced. The Mass of Christian Burial will be held tomorrow at 2:00 p.m. at the Cathedral Basilica of St. John the Baptist, located at 222 East Harris Street, and interment will follow in the Catholic Cemetery. The family requests that in lieu of flowers, to please make donations and contributions to the restoration project at St. Benedict the Moor Catholic Church of Savannah. And donations can be mailed to 556 East Gordon Street, Savannah, Georgia 31401. 556 East Gordon Street, Savannah, Georgia 31401. I have ordered flags on City of Savannah buildings to be lowered to half-staff today through tomorrow in honor of the life and the legacy and the contributions of Representative Edward Mickey Stevens. Yesterday, the FDA fully approved Pfizer's COVID-19 vaccine. It is the strongest endorsement that the agency can give, and now makes this vaccine official and certified as any other medication that we take on a daily basis. It is reasonable to expect that additional approvals will be forthcoming for Moderna and for Johnson & Johnson. Hopefully, this will increase the confidence of those who are vaccine resistant or hesitant about the effectiveness of COVID vaccines. Our community transmission rate remains very, very high and much higher than in the first two surges. The Delta variant of COVID-19 virus is much more contagious than earlier versions and now accounts for 99% of all COVID infections in the United States and in Georgia. In Chatham County, still less than 50% of our county-wide population is fully vaccinated. About 44% are fully vaccinated, and about 51% have had at least one dose. We know that over the last 6 weeks, the highest infection rates were those in ages 20 to 29, 30 to 39, and 10 to 19, in that order. The lowest infection rates were in those aged 60 and older. We also recognize from the data that women are infected at a higher rate than men, but men die at a higher rate than women. We have had over 26,000 confirmed COVID cases here in Chatham County and over 2,000 hospitalizations. Of the 463 confirmed COVID deaths here in Chatham County, over 80% of them were hospitalized. So about 370 people were hospitalized out of the 463. So while breakthrough cases are happening, and we expected they would happen, they are rare. And if they do happen, we know that the vaccines prevent and help keep people from getting seriously ill or dying. Department of Health data shows that as of August the 17th, just 0.004 of the more than 4.3 million fully vaccinated Georgians tested positive for COVID. 0.004 of more than 4.3 fully vaccinated Georgians tested positive for COVID. And of those, just 0.002 were hospitalized. And of that, 0.00003% died. Let me change that. 0.0002% were hospitalized, and 0.00003% died. So we want to make sure that the facts are what they are. In Chatham County, our COVID rates continue to grow out of control as we recorded our highest community transmission index ever of 1,270 on Friday. That means that 1.3% of our county tested positive for COVID in just the last 2 weeks. Our 7-day rolling average of new cases is about 290, just shy of the all-time high we recorded last week. About 270 people are currently hospitalized with COVID in Chatham County. And the Department of Public Health data shows that in our region, more than 85% of general inpatient beds, almost 94% of ICU beds, and about 80% of emergency room beds are currently in use. 42% of the ventilators available in our region are currently being used. What does that mean to us? Well, it means that if people are sick for other things, then they may have a harder time getting emergency care, particularly since medical personnel will have to make decisions about who's sicker. And I would not want to be that individual that needs help, but I'm not able to get the help as quickly because there are a bunch more folks that are sicker than I am. And that's the reality. We know that there are some people who are pregnant, for example, would usually deliver, and they're delaying some of those deliveries. So please protect yourself and protect our community by getting a COVID vaccine. Last week, I met with my medical advisory team that has been a constant source of advice and support during this pandemic. The city manager, Heath Lloyd, his executive team, and I had the opportunity to hear directly from these respected local professionals and practitioners and to learn about their recent experiences and receive their recommendations regarding our next steps. Now, from a purely health-related viewpoint, we discussed reinstituting several mitigation strategies, including limiting indoor social gatherings to 10 to 15 people, limiting outdoor social gatherings to 25 to 30 people, and requiring bars, clubs, restaurants, gyms to adhere to a 50% indoor capacity. While this is drastic, these measures were deemed necessary to immediately make an impact to limit community spread, and hopefully with increased vaccination strategies, we hoped that we can get COVID back under control again. So after lengthy discussions, careful consideration, discussions with Mr. Lloyd and his team, and I am revising my current emergency order to do the following. First, revoking all permits for events in the public space effective immediately through September the 30th. This will not apply to weddings, but we're having some very courageous conversations with our wedding planners, and they are going to be expected to adhere to strict social distancing and mask guidelines. That being said, we have asked the Savannah Jazz Festival and the Savannah Philharmonic to consider virtual platforms for their festivals this year. The city will offer whatever assistance we can to ensure that these events can be executed in a virtual or hybrid format. The annual United House of Prayer parade will be canceled, and I have asked Savannah State University to strongly reconsider having their homecoming parade this year, even though their parade is not scheduled until October. I just don't think that it's safe to have large gatherings such as parades at this time. No new permits will be issued until further notice. Public events scheduled at the Savannah Civic Center will be canceled or rescheduled to a later date. Community centers and most city buildings, including City Hall, will be closed to the public until further notice on a schedule that the city manager will release. The Coastal Georgia Center on Farm Street will remain open for the handling of city business, and as before, masks are required in all city buildings. We will step up our enforcement on trolleys and other tours where masks were previously required. We are asking our mobile tour operators to comply to avoid any unpleasant consequences. We are serious about this, and so therefore we don't want to be punitive, but we will. And I've asked the pastors, ministers, rabbis, imams, and temple leaders of our Savannah Faith Task Force to reevaluate their current worship formats and to consider reducing in-person contact as much as possible. These measures are admittedly inconvenient and uncomfortable, but again are taken as deliberate intermediary steps in lieu of more restrictive steps that have been recommended, like reducing the operating hours of bars, clubs, and similar establishments. And that is still on the table. We are considering implementing these measures if the proposed measures fail to significantly decrease our community spread. Masks are still required in City of Savannah government buildings, hospitals, early childhood centers, elementary and secondary institutions, guided tours within a vehicle, and federally regulated transportation. Anyone entering a commercial establishment in the city is still strongly advised to wear a mask inside. Now, I'll say this very briefly that obviously the governor last week thought it was in the best interest of saying that local businesses didn't have to listen to local governments, and I'll just say, don't try us. Don't try us. We believe very clearly that we have the standing to do so, and obviously, if businesses choose not to comply, then we have to continue restricting, and we don't want to do that. Obviously, the more we restrict, the more it affects business. So we have to have healthy people build healthy businesses build a healthy economy. You don't build a healthy economy with sick people. And so I want to be very clear about that. The governor did whatever he felt that he wanted to do. There was nothing from Savannah or Atlanta that he specifically mentioned that talked about restricting anything. But the fact is that since he went there, that's where we are. But again, we believe very clearly, and we're not picking any fights, but we will defend our ability to protect our citizens, period. We'll continue to watch our numbers and our trends, and then we'll make a decision about October and November in mid-September. So Savannah, it's up to us. It's totally up to us. If we do better, we get better. If we don't do better, or people want to continue this we don't have to listen what the city tells us to do, that's fine. But then you'll start seeing October events canceled, November events canceled, December events canceled. So we can work together, or we can perish together. And I'm not trying to perish. We're trying to do what we can to protect our citizens, do what we can to protect our employees, do what we can to protect our businesses and our communities. And I want to thank the businesses, the many businesses. I want to thank the hotels that are instituting a mask requirement. We appreciate that, and we'll be lifting you up at a later date. Tomorrow, Chatham Area Transit and J.C. Lewis Primary Healthcare are partnering for a vaccine clinic at the Joe Murray Rivers Jr. Intermodal Transit Center, located at 610 West Oglethorpe Avenue. Both the Pfizer and the Johnson & Johnson vaccines will be available from 9 a.m. to 12 noon. St. Joseph's Canada is offering free rides through September 30th to Chatham County residents who make a vaccine appointment at a coastal health district location. You must first make an appointment to get your shot by calling 912-230-5506, 912-230-5506, or by visiting gachd.org/vaccine, gachd.org/vaccine. Once you've scheduled your appointment, call the Transportation Assistance Line at 912-819-2883, Monday through Friday from 9 a.m. to 5 o'clock p.m. Please call or book your ride at least 3 hours in advance of your scheduled vaccine. If your appointment is the next morning, we want you to call the day before. You may call as early as a week in advance of your appointment to arrange for transportation. If you have not scheduled an appointment, you will be asked to schedule one, and then you will then call back to schedule transportation. St. Joseph Candler is working with the Yellow Cab Company to provide this transportation. The cab will pick you up, take you to the vaccine appointment, and then wait for you to get your vaccine. The cab will then take you back to the original pickup address. The cab is not allowed to make additional stops for other purposes. If the person requests that the cab make additional stops, then that complete fare will be the responsibility of the rider. Patrons will be asked and required to wear a mask for their entire ride. The Yellow Cab Company has the right to refuse to pick up an individual who refuses to wear a mask. So to participate in this program, you must call the Transportation Assistance Line at 912-819-2883. 912-819-2883. If you call a cab company directly, then you have to pay the fare. So call 912-819-2883. 912-819-2883. And so thank you to our community partners, St. Joseph Candler. Thank you, Yellow Cab, and everyone else who is working to make vaccination accessible, convenient, and easy for everyone. If you need a COVID test, you can get one from the Savannah Civic Center Monday through Friday from 8:30 a.m. to 3:30 p.m. and every first and third Saturday of the month from 8:30 to 11:30 a.m. Demand has been extremely high, so the Coastal Health District strongly recommends that you pre-register at covidtestsavannah.org, covidtestsavannah.org, or by calling 912-230-9744, 912-230-9744. There are two more chances for you to help shape Plan 2040, which is our community's comprehensive plan. The Metropolitan Planning Commission will host neighborhood meetings tonight at 6:30 p.m. at the Windsor Forest Community Center and virtually on August the 31st at 6:30 p.m. And you can register for the virtual meeting by following the link on the top story section of savannahga.gov. This weekend, Savannah and Chatham County residents 18 and older can get free dental care at the Garden City Recreation Center at 160 Priscilla D. Thomas Way. Cleanings, fillings, extractions, and x-rays will be available on a first-come, first-served basis. The dental clinic will be from 5 a.m. to 4 p.m. on Saturday, August the 28th, and from 5 a.m. to noon on Sunday, August the 29th. And no ID is required for dental care. Looking forward to our City Council agenda this week will be the culmination of our discussion during our mid-year budget meeting last month, when the City Council reached consensus to maintain the current millage rate. And we wanted to use that as an opportunity to deliver on our promised pay raises for the awesome members of Team Savannah who have worked and performed admirably during this crisis. We are recommending a pay raise of 3% for all eligible city employees, retroactive to July the 4th, 2021. This would also include an additional 0.5% for police beyond their modular pay allotment of 2.5%. So, in other words, their modular pay plan is 2.5%. We're going to give them the 0.5, so everybody will be 3% across the board, except for Chief Mentor. I'm sorry, Chief. This proposal will amend the city's 2021 operating budget and will cost us an additional $3.5 million. Remember, maintaining the current millage rate kept us from losing about $2 million. So we'll cover a good piece of that. And in my opinion, this pay increase is well deserving and long overdue, and I hope that we can get it done. Mr. City Manager, thank you and your team for helping to expedite that. We are also considering a contract this week for moving services to relocate more than a dozen city departments to the city's new interchange court facility as we continue our intentional move from buildings that we lease into buildings that we own. So we're working hard on that. Chatham County Chairman Chester Ellis, Savannah Chatham Public School System Superintendent Ann Levette, and Chatham Area Transit Director Valerie Ragland and I met last week to discuss strategies to improve vaccination rates at the city, county, the school system, and CAT. We are proposing to investigate a vaccination incentive program for our employees, both vaccinated and to be vaccinated, to help boost our vaccination rates by simultaneously offering a vaccination program for our employees with similar incentives to show unity and to discourage competition among this county's largest public entities. And the proposal is that we would all pay for these incentives using the ARPA funds, which is partly what it's for. So on Thursday's agenda, I am proposing for Council's approval a resolution to direct the city manager to work with his counterparts at the county, the school board, and CAT to create and implement such a program with consistent incentives and vax by dates. We believe that this will be a significant step in helping our community become vaccinated. And I'm just pleased that our public employers are finding mutually beneficial ways to be able to work together. And so if we're below 50% and we can get significantly above 50%, and the county does the same, and CAT does the same, and particularly the school board, if they're able to get above that, we're looking in much better shape. And this is important because if our schools close to in-person learning, it affects all of us because our parents are at the county, they're at the city, they're at CAT, and so now it affects our workforce. It affects those police officers. It affects those firefighters. It affects those office personnel that now have to scramble, and in some cases there may be no alternatives. So it is well within our best interest to try to get as many of our folks vaccinated as possible. So looking forward to working with them. So that ends my prepared remarks. Now entertain any questions you may have.
Good morning, Mr. Mayor.
Good morning.
When you talk about this incentive program for city employees, what type of incentives are you thinking of?
Cash. Right now we offer basically 8 hours of leave. We recognize it's not getting us there. And in talking with our other partners, we recognize it's across the board. And so obviously I don't think that should be a decision that we should make as CEOs of the organizations, but that the managers should make. And so they'll work together, they'll propose that the managers were involved in the conversations. And so, the goal is for us just to approve the resolution and let them work it out. The county is expected to do it on Friday. I believe CAT meets today. And so at the school board, I believe it meets next week. So again, I think you'll see it kind of all flowing together. And the goal is let's work out a plan. I don't want the county to offer this much and the city's offering this much. I mean, it should be pretty consistent. And let's get a date that we want people to have their vaccinations. So if we're saying you have to have both vaccinations by November 1st, then we should expect that there should be a decrease in infections because we would have more people vaccinated. And we will be able to count it because we would know how many people would become vaccinated. So, the goal is, to try something new and different. But I think here the takeaway is that we're working together. We're not working in a vacuum, and I was just really pleased to work with Superintendent Ledet and Chairman Ellis and Director Ragland to at least start this process.
Would part of that plan include retroactively, giving cash to city employees who have been vaccinated?
Yes. I do not want to incentivize delay. I think that, for employees who have stepped up, I think they should be entitled to that. But again, those are program details, and the managers will work that out.
Now that the FDA has approved Pfizer, is there a possibility that you would require the vaccine after this program ends? What does that look like?
It's possible. It's on the table. I think that the Pfizer, and the interesting thing is that many people, they say, well, the FDA didn't approve it. The FDA did approve it. It was approved for emergency use. Now it's approved for regular use. So now you'll also start seeing it advertised, because now it can be advertised. And again, it's reasonable to expect that Moderna and Johnson & Johnson will be soon afterwards. So you see now the Department of Defense is requiring vaccinations. I expect soon to see hospitals requiring them. And ultimately we might do the same. So we're watching. That's still on the table.
You mentioned unpleasant consequences for tour companies not following the mask mandate. Can you kind of elaborate what that means?
Citations. And again, it's easy enough to see. I ride by them all the time. They have to be a part of the solution. And so we hope they see the need, because the more things that we restrict, the less people come. The less people come, the less people tour. And so we don't want to go there. We recognize all of this is connected. We have been such a blessed community. I went to Philadelphia last week, and I stayed at the Philadelphia Marriott. The Philadelphia Marriott, for those of you who are familiar with Philadelphia, is connected to the Philadelphia Convention Center. And the group that I was there with, the folks were telling me they had been closed for 17 months. 17 months. And that my group was the second group they had in 17 months. While hotels here in Savannah are having their best days ever, over 95% occupancy. And so if wearing a mask helps us to stay open longer and go further, I don't know what the problem is. If it helps to keep our numbers down so we can keep chugging along, then why not be able to do that? And so again, I think, obviously the governor, for whatever reason, tried to jump into that fray. But the reality is that, this is Savannah. And, obviously we hated to have to start canceling things, but there'll be more to come. And so, that affects people's business, and we recognize that. So work with us, be proactive about it. Don't have such a negative, lackadaisical attitude about this. We're not doing this for us, we're doing this for all of us. And work with us to get these numbers down, because as I've shown, I follow the science, I don't follow politics. When the numbers get down to where they were before, the mask mandate goes away. The threshold that the governor said was 100. Last week we hit 1270. So it's obvious. So we're 1,200 times more than the 100 threshold that the governor set himself. Yet he chooses not to issue a statewide mask mandate. It makes no sense to me. And Chatham is not the worst in the state. We're like 6th or 7th. So there are communities in our state that are having a much rougher time. And so I'm just not going to sit here and just let my community die and not do anything about it. I refuse.
When you say citations for those 4 companies, do you mean for the company itself or for the person not choosing to wear a mask?
For the company. For the
Have there
company.
been any personal citations for people not wearing masks?
I don't believe so. I don't know. But herein, we want to warn, and this is the final warning. So I don't want it to be said that things won't change. No, that was from before. You talk about this time? No, right. The last time it was 6. Yeah, we haven't done, but I'm saying now we are.
Has there been a conversation between you and the organizers of these events that will be canceled?
Yes. Yes. Again, I mean, our goal is not to surprise people. I've spoken with the head of the Jazz Festival. They have a plan B. City staff have talked with the folks at the Philharmonic. I've spoken with the United House of Prayer. I've spoken with Savannah State. Again, we have several festivals and rides and runs and parades coming up, and again, what we do now will depend on what happens then. So, thank you.
Good morning.
Good morning.
So when will you decide on these other measures that you mentioned you discussed with your medical advisory team?
When did they do it?
When will you decide on those other measures that you mentioned that you discussed with the medical advisory team about?
You mean with bars, clubs, restaurants? We'll make a decision between now and mid-September. We'll see how our numbers are. We recognize that there was a blurb that is supposed to kind of apex and then be able to decrease. We'll see where we are. It depends on what people do now. You know, we can take proactive actions to lessen the severity of our exposure. If we're able to do that, then we've created a situation where we're able to do that. Everything we're doing here is kind of reactionary to what's out there in our world. And so we have people coming here from all over the place. They are coming from all over the country. They're coming from places that are hotter than we are. And you know, we need as a community to say to our visitors, we are glad that you're here, wear a mask. And we need to say that as a community. And just for people to say, oh, well, nah, well, we don't have to. Again, to me, it is crazy. You're cutting yourself, cutting your own foot off.
Do you know roughly how many events will be affected by moving the permits in public spaces?
The largest ones are the ones that we talked about. The Jazz Festival, the Philharmonic, the 2 parades are the largest ones. Again, we have a bunch of weddings that have been scheduled. Many of them have been pushed back 2 to 3 times. We recognize that, and again, we understand that. So we're having courageous conversations with them, and we're saying, you will social distance, you will wear a mask. And if you cannot comply with that, then you need to go ahead and just cancel as well. We're hoping they'll do the right thing. We want this to be their very special day, and maybe we'll include that the bride and groom don't have to wear a mask.
Thank you.
The first kiss is probably not really cool with a mask on.
Thank you.
Thank you.
Morning, sir.
Good morning.
So we have a lot of big events coming up in October.
Yep.
Have you already started the conversations with the folks with, say, for instance, the Jewish Food Festival?
Yep.
We have SCAD Film Fest, which occupies a portion of Broad Street. So again, all those conversations.
City staff are starting those conversations now.
And again, to be clear, we're not revoking these latest revisions until we hit a CTI of 100 or lower. Is
That's been kind of my standard, that we're trending down below 100. And that was for the mask.
Right.
That's for the mask.
Okay. Sorry, got a series of texts.
I see. Good morning, Saria.
I think that covers it. Honestly, I just want some clarity on that. And then the possibility of mandating vaccines for city employees down the road.
On the table.
On the table. And, oh, she says hello. I think that does it. Thank you.
Let me say this before I leave, and I really am appreciative. Again, I became mayor in January of 2020. 2 months later, we were in the middle of a pandemic. So most of my administration has been in a pandemic. And I really have created a strong kinship with Atlanta Mayor Keisha Lance Bottoms, with Augusta Mayor Hardy Davis, and with Athens Clark Mayor Kelly Gertz. We have become a band of brothers and sisters, if you will, in that we are all extremely intent on ensuring that our cities are safe. And I just salute these great public leaders for standing with me as I stand with them to ensure that our communities remain safe. And so I appreciate that. Because the fact of the matter is, as it is right now, Georgia, the state, is not helping our cities to fight COVID. Georgia ranks 48th nationally in fully vaccinated residents over age 12. We rank 48th. But we rank 7th in COVID cases. And we rank 12 in COVID deaths. You think about that. This is a race to the bottom that we're trying hard to seem to win. We're next to Florida, which is among the hottest in the country. We're right on the I-95 corridor. And so for us, this is a matter of survival. That, executive orders can be done to keep businesses open, but the Department of Labor has been closed for months. We're going to show some leadership about keeping things open the Department of Labor so people can get their unemployment assistance. You want to show some leadership, then open the governor's mansion so people can take tours. We're going to open stuff up, then open it all up. The welfare of our state depends on the health of our cities. The welfare of our cities depends on the health and welfare of our citizens. And so it's cumulative. And so therefore, we have to work together. We have to get people vaccinated as quickly as we can. We have to wear a mask. We have to ensure that we're doing this together, because COVID does not care who it affects. And as you know, and I've learned, that viruses learn quickly. And that's where the mutation happens. They get smaller. And so there is a Lambda variant on the way that will make the Delta variant seem like a child. So we have to do what we can. And so, I'm just hoping that we can be better, we can do better. And I'm just willing, if there's any conversations willing to help make that better here at Team Savannah, we're committed to being able to do that. So, thank you all so much. Chief Mentor is here if you need him. May God bless you all. May God bless Savannah.